Hello, welcome back to Proactive New York. Happy Friday. I'm Christine Corrado. With me right now is Nader Pourhassan, CEO at CytoDyn, and Bruce Patterson, diagnostic advisor to CytoDyn. Great to have you both. How are you?
Great. Thank you for having me.
A rare, mysterious inflammatory disease in children is prevailing here in New York. Some are saying it's associated with the coronavirus. Dr. Patterson, can you just kind of talk about how this disease affects children?
Yeah, it's an interesting disease that's been investigated for quite some time, and it's very clear that this disease, a major component of it is inflammation, and that fits with what we're seeing in COVID. But in particular, Kawasaki's has been shown to have elevated levels of RANTES, which for the last two and a half months, when we discovered high levels of RANTES in these COVID patients, has been a recurring theme. As you know, it's 100 times normal in severe and critical COVID-19, and it's 5 times the normal levels in even mild to moderate COVID disease. So it's not surprising to find a RANTES-driven disease like Kawasaki's rear its head in this patient population, which again involves vascular inflammation and obviously at some point aneurysms in these blood vessels.
Well, IncellDx, the company that you run together with CytoDyn, has announced that they're offering free testing for this. What do you hope that this achieves?
We're uniquely set up right now, obviously because of the RANTES in COVID that we found. We're uniquely set up to do this testing. We have a panel that does RANTES, another protein called MCP1, and another protein called IL-1 beta, all three of which are significantly elevated in Kawasaki's.
So how widespread potentially do you think this could become? Could it be like another coronavirus?
Well, I think it's due to coronavirus. I think it's a manifestation of coronavirus, which we've already shown to have high levels of RANTES and be driven by RANTES inflammation throughout the body.
And Nader, can you kind of talk about what the kind of recent developments that have been going on with your coronavirus treatment, leronlimab? What's kind of the latest here with these various trials that you're in?
Our phase 2 trial is for 75 patients. We have clearly passed the halfway through the trial, 50%. So we could ask the FDA to allow us to have a data safety monitoring board, look at the data and let our shareholders and everybody know where we're sitting. We believe it's going to be very exciting results, but nevertheless, we are going to finish hopefully the enrollment by the end of May. So if that happens by middle of June, we will have results to announce to the world. Hopefully we will be the second product that has great results and be able to go forward with the approval.
Yeah, I mean, do you think this could be the next big thing? It seems like you're fairly confident.
Well, we think it's going to be a very big thing. As Dr. Anthony Fauci said, remdesivir is not a great solution. It's better than zero, so it's something. And comparing to remdesivir, we believe, as Dr. Patterson has explained in detail why we believe better. And perhaps Dr. Patterson can speak a little bit about that.
Well, again, I think the important fact is that we've found a key protein in the pathogenesis or the pathology of COVID. And then using a drug that addresses that key protein and seeing response, it lends credibility to the whole story about leronlimab. The problem with remdesivir is that here's an antiviral that hasn't been shown to lower the virus. And I think that's absolutely critical. And I think that's why it's so important to have this joint effort and have the laboratory data be able to fit with the clinical outcomes and show that this drug works at both the molecular cellular level and with patient outcomes. I mean, that just lends the utmost credibility to the whole story about the success of this drug.
Yep.
And just lastly, on a separate note, Nader, the BLA for the HIV indication, that's all wrapped up?
But we submitted what we believe it's a complete package. We need to wait for FDA to get back with us and say that this was 100% completed, and then priority review will be filed next week.
Great to hear. Really appreciate the time from both of you, and have a great weekend.
Thank you for having us.